everybody. This is Erica Mello, and welcome to episode number 68 of Tough to Treat. And this was a great discussion between Susan and myself, and it was actually a lot of fun. It was a patient of mine who had some issues with her knees and her hips and her low back, and she turned into a couple of very sensitive nervous system issues going forward. And I wanted to bring her up because she had been moving along really nicely and with her program, and we started to go into very high load, high level. And her foot, which is a secondary issue, came into play. And Susan and I talk about some really interesting balance concepts as well, vestibular issues that can come up with patients like these, especially postpartum. I really enjoyed this podcast, so I hope you will as well. And if you haven't joined our Facebook group, we would love to have you. The name of the group is Tough to Treat, and then in parentheses, podcast. And we would love to have you in the group. So thanks again. Bye.
Hi, everybody. This is Erica Mello and Susan Clinton, and this is podcast number 68 of Tough to Treat. Hi, Susan. How are you?
I'm good, Erica. How are you?
I'm good. The best I can be. I'm being in my apartment now for the foreseeable future.
Mm-hmm.
So we're recording this mid-March. So anybody who's going to listen to this when we come out, we are both home and,
Working from
here,
home.
working from home. So here we go. This patient is a patient of mine who is very interesting. So a reason why I wanted to talk about her is because I'm going to fast forward, because as I rehabbed her, something else came out. So I'm going to sort of fast forward through the initial consult and things like that, because I know we all have patients where they're going along and they're motoring along, then all of a sudden something else hurts, and that's common. And I see that with patients or other people's patients that they're starting to do increased loading. So I will explain as we go on. So this is a woman who is here in New York City. She originally came to see me with complaints of left knee pain, with knee pulling was the quote unquote. And she had a secondary complaint of left hip and low backache, but that wasn't primary. That was just sort of came out in the subjective. And what really aggravated her knee was, full kneel, getting on the floor with her. She has 3 children, getting on the floor with her 3 kids, kneeling, sort of like how we kneel in the clinic, getting on the floor, and also doing like a figure 4 position, crossing her legs. That's what really, really bothered her. And I will fast forward. In my initial evaluation, I determined that the main issue for her, or the driver, as we say, was in her thorax, and not because it was a stiff, immobile thorax, because she had a loss of control there. Most likely from carrying her kids on both of one side of her hip, depending on the child. I think her kids are probably, I want to say 2 years apart, maybe less, a little more, but close. So, and she's very, very fit, hypermobile, really strong, did a lot of exercise in the past, aerobics instructor, things like that. But she definitely had a loss of the thoracic control. The screening task that I did use for her was I took a look at her in standing, and I also just took a look at her in like a squat with an arm raised, not because squatting bothered her, but because she had a lot of aggravating positions. Like I can't evaluate somebody in a full kneel position. I can look at them do that, but it's hard to sort of see what's moving and what's not in that position. So I find doing a squat with a bilateral arm lift a great way to screen the whole body. So fast forwarding,
Wait,
I found that
before you go forward,
Okay.
Just one question, because I think it'll help clear it up for everybody who's listening too.
Yeah, okay.
When you're talking about loss of control in the thorax, are you meaning like just discoordination, like the thorax is moving
Translating.
and is translating over to one side when it should be kind of hanging more into the center?
Correct.
Something like that? Okay.
Yes.
All
Yeah.
right,
So when I
great.
had her squat, her thorax would go to the right. When I had her
Okay.
lift her arms, her thorax would go to the left. So it wasn't like, she was
Right.
rotating.
So she was just
right?
basically kind of, yeah, it's kind of like what Sarman kind of looks at with, that she's not disassociating her movement patterns, that the thorax is being pulled with the arms this way or pulled with the legs this way, and it's not really holding its own.
Correct.
Gotcha.
Correct.
Yeah.
Correct. And her center of mass was going way to the left.
Yeah.
And that was coming from the thorax.
She should be able to raise her arms in the air without her thorax translating over.
Correct.
Gotcha. It's kind of the same thing like we look at with the low back and the hip.
Exactly.
We should be able to bend the hip without having the low back go into full flexion.
Correct.
Yeah. Okay. Gotcha.
Correct.
Okay.
So
carry on.
So okay. so I treated her as if she was the thorax driver, had a loss of control, mostly upper rings, 1, 2, 3, 2, 3, 4 rib. I mean, I term them rings from all the work I've done with Diane and LJ, but upper ribs basically more so than lower. So more arm movement than lower trunk movement. Okay. So upper rib cage. And so I treated her based off of that. So initially, because I'm going to fast forward because this is really what I want to get to. So initially, we talk about self-checks, right? So for her, she was really in tune with her body. And for me, the most sensitive movement for her, as we figured out, was cervical spine rotation right and left. For example, if she picked up a 5-pound weight and did, military press 10 times, she turned her head to the right, it was worse than as before. So there was something in that arm movement that made her worse. So we could have looked at seated trunk rotation. It wasn't as sensitive for her. So we basically did neck rotation as a barometer or a self-check. Okay. So, and that is continued to this day. So I gave her initially, besides some of the release work that I've done, I'm doing more dynamic release. She was overusing her scalenes, her sternocleidomastoid, her clavicular head and pec. So I did a lot of dynamic release there way at the beginning. And I put her through a exercise program, did some open chain, upper extremity. I call them tricep extension, skull crushers. I had her do leading wall lands where you're sort of landing on the wall with your arms slightly bent, more closed chain. I progressed her through a lot of that as standing arm raise. We had her do a wall dog, like a down dog on the wall, to almost like plank on the wall. So plank on the wall, then doing a dog on the wall. And I had her do push-ups. I progressed her through all of that. Over the summer, she developed bilateral ulnar neuritis. My guess is from a virus of some sort, and that sort of set her back a bit. It made a lot of these upper rings, lower neck worse.
Did her knee pain return?
No, actually it did not. Good question. It did not. Her knee pain was pretty much gone, and it was arms. It was all ulnar distribution, positive ulnar nerve test. So because I believe that a driver can, or the cause of a problem can be carried over to, not no matter what diagnosis you have, but I think it's prevalent in a lot of movements. So I went in and modified. I sort of held her. I gave her a little bit of decompression in her upper thorax as she did her ulnar nerve tests, and they were actually better. So, but she still had the ulnar nerve sensitivity. So I'm going to fast forward through that. That lasted about a month. We did ulnar nerve glides. I continued with the program. That went away. Fast forward to now. So she's doing significantly better. I added lunges, side lunges, forward lunges, lunges with rotation. I had her do the star lunges where you're lunging in a star pattern. I ended up giving her some, we call it bow and arrow, where you're sort of doing a bow and arrow with the TheraBand. I had her do that and had her do squats with rotation, squats on a Bosu, did well. I started to have her do some jump squats, jump side to side, and then her foot started to bother her. So, and that was secondary. That was, going back. Her foot was in the picture, but it didn't come up because we were doing not high impact activities. The minute we started to do some high impact activities, she's like, "Oh, my foot's really sore. Everything else feels great. Now my foot's sore." And I'm like, "Your foot's now a player in this program." I'm going to stop there and let me know what your thoughts are on that.
So I'm still trying to pull them all together here.
All right. So
it sounds like the top load is driving some of the stuff that's happening in the lower load. It seems like with the right movements and stuff, it got cleared up. What was she looking like when she was jumping and these jump squats and stuff? Was she back to her thorax wobbling all over the place?
So when I saw her in the clinic, she wasn't, but she said she felt that when she was jumping, she was shifting to one side when she landed.
Mm-hmm.
Yeah. And that's what clued us in. And
Okay.
I think it was her left foot. So left knee, left back, left foot. So, I progressed her through a program, and I left a lot out, but, a program where she did a lot of open chain upper extremity work, and then closed chain. Then I had her do squats with an arm lift, basic progressions. And then we started to go into closed chain arms and legs, like dog, plank, things like that. And she did well with that. She had a hard time weight bearing initially, full, like going on hands and knees and going full weight bearing onto the arms. That was a problem at one point because it's a higher load for her. That got better. And the reason why I brought her up today is because I want to talk about this foot thing that's come up. But she did pretty okay with the program that I gave her up until we started to do the plyometrics. So I had her skip, I had her do jumps, and then when she landed, she felt like she was really, really off. So what I did was I took a look at her foot in just the basic screening test. I just had her do a squat. When I looked at her squat back at the beginning, when I first saw her foot, so when you squat down, the foot should, pronate a little bit. It should fan. Hers did. But then when she came back up, it wasn't sort of folding. Like when she was going to do a little heel raise, she went into that sort of plantar flexion inversion twist. So she didn't have a good control. So when she squatted, her foot pronated and fanned, but when she came back up out of the squat, and I said, just do a little heel raise, she couldn't get up on the ball of her foot on the left because there was a twist there. That's what I saw at the beginning, and I noted it down. But because she was doing really well with the upper extremity and the low load, lower extremity work I was giving her, the lunges, the squats, etc., we kept progressing until we did the plyometrics. And that's when her left foot started to bother her. So do you have any other questions, or do you want me to explain
I do,
anything?
actually.
Okay.
I do. I have a few questions here.
Okay.
How old are her kids?
I want to say 10.
Okay.
13.
Okay.
And 14, or take a year off, maybe 9, 11, and 13 or something like that.
Okay.
I think I may have, you know what? I'm actually going to look at her eval. This was a while ago.
And did she complain of any dizziness?
No.
Balance issues?
No, not at the beginning. No, she had difficulty going on her left leg going forward, but not at the beginning. No.
So it would be interesting to find out if and when she ever, like, where she sits in the car.
Yeah, hold on. Her kids, 10, at the time I saw her, they were 10, 8, and 6.
Okay. It'd be interesting to know where she sits in the car, if she drives or if she's a passenger, and if she ever sits in the back seat.
Uh,
If she stopped riding rides, what's gone on. This is a typical kind of thing I'm seeing with postpartum women.
oh, interesting.
And it creeps up on them. It's very slow. You know, they don't realize it. They just normalize it. So they don't realize they start, you know, with the thorax kind of just going to one side and kind of that posture of holding the child, and you have 3 of them and you're pregnant 3 times and your posture and head stuff resets to that.
Yep.
And in some women, it causes extreme dizziness. In other women, it's just like this very subtle kind of thing that goes on. They just don't know it. They're just like, they're just not doing the spinning. They're not rotating like they should. They've just lost some of that. They've got a lot of gaze fixation that they don't realize they're doing. And when you put her into these things, you had to like work her up and get her out of her sensitive nervous system, or get her nervous system to not be so sensitive, which is like totally spot on. Because that's what you're dealing with here, is a pretty sensitive nervous system for
Yes.
whatever reason. And that could be even hormonal, you know, sleep, food driven as well. I mean, there's so many inputs to a sensitive nervous system. But the
Totally.
movement stuff was really helpful for her, you know, and spoke to her in a good way. And you were able to take her through the compressions and then adjust as like, because it's interesting, she got sick and then ended up with a much more sensitive nervous system again.
Yes.
You know, so there's some stuff going on in there. But what made me think of this, besides the foot issue that we moved into, was in the very beginning, turning her head to one direction was the trigger movement that meant she needed to stop and do
Yes.
the other thing.
Yes. Yes.
And so
Yes.
whenever I hear that and I hear about the head, and then I'm thinking balance issues, because to me, she's got a kind of a system control issue that's going on here around the balance system if you're doing plyometrics.
Yep.
And I'm beginning to wonder, especially since it's all upper rib,
Yep.
it sounds like it's upper
Yes.
cervical as well. And
Yep.
that's the system that really is involved here.
Yep.
And is the last one that has not been pulled back in. So that's why the foot's a player, I think, in my opinion, that the foot is a player along with the vestibular, eye, ocular, vestibular, cervical reflex
That's awesome.
system,
Yeah.
you know, because
Yep.
that's where she's missing. And there's a lot of talk around really high athletes. Like Scott Epsley told a story once that really kind of impacted me a bit. He works with the basketball team, I should know the name of it, in Washington, D.C. And he was talking about a really high athlete that had rolled his ankle in a game, typical injury in basketball. And they did all the regular work to get him back. And he said that he was re-injured. And he goes, I went back and looked at the tape. And he goes, and you can just see it. As soon as he turned his eyes and raised his arm and did something towards the ball going up, you could see that he didn't have any control as he came down. And he goes, he was completely missing some deep level, kind of reflex response.
Oh, that's
And that
interesting.
pulled him into that position to where he rolled over onto his foot again, because he goes, nobody spent the time to like bring that deeper system back in.
Oh,
and I
that's
thought about
amazing.
that for a long time. And I thought, because that's something that is just so subtle, you don't even think about it.
Totally.
This case is really totally magnifying that kind of idea to me a little bit here.
Yeah.
And, you know, and and I, for everybody listening out there, I had no idea where we were going with this case when we first started. So I just, you know,
True.
it's just all kind of coming up as we're talking. And yeah, so I'm just wondering how much of that, what, anyway, so what did you do? I'm interested
So anyway,
in what you did, because
yeah,
it's
so
going to help.
yeah. So I'm just looking back at my notes. It's interesting. Back in August, when this all happened, I wrote down she had I think she actually got bitten by a dog. Broke out in hives. This is what I wrote down. Onto left arm and part of right arm. Started feeling arm weakness, shakiness, facial numbness, temperature changes in hand, and nausea. Okay, so as you're saying that, it makes complete sense, and was worked up and everything, and nothing really remarkable.
Yeah, because it's all like these like little system. It's all these stuff that people dismiss, but this is a true example of a trigeminal system that's getting blown out of control. A dog bite is a threat.
Totally.
I mean, that's a total
be a
threat
to
to
me.
the system. Yeah, exactly. And you already have a sensitive nervous system in that area. And
Mm-hmm.
so
Mm-hmm.
you get this abnormal vagal response, which is the nausea and the shaking and all of that kind of weird stuff, because you've got this sympathetic trigeminal system that's really being driven at a higher level. And you can't
Mm-hmm.
help but have an abnormal vagal response to it, where they call
Yep.
it an aberrant vagal response, whatever. Because
Yep.
that has to rise up to meet that sympathetic response, and leaves, and there's really never, how do you go in and say this is what you have going on, because there's not any kind of definitive thing. She's probably still strong, she probably looks fine, she's not unwell, she's not running a fever, she's not, none of the,
Right.
the health markers that they look for. But here's this
Mm-hmm.
person that's clearly, probably looked like or felt like she was on the verge of an anxiety attack,
Yes. Yes.
all the time,
Yes.
because you're just having this whole thing going on.
Mm-hmm. Mm-hmm. And she had
So,
they gave her, diagnosis of, transverse myelitis.
oh yeah,
I mean,
that's
yeah, yeah,
helpful.
yeah, exactly. Real good, right? And
Yeah.
you know, uh, just over a period of a month, I think her system was definitely weakened because she had, you know, thought she was getting a bacterial infection. I mean, things just like that were sort of cropping up. I'm just going through my notes here.
Yeah.
And once she sort of came out of that, which was probably about 5 weeks in terms of symptom, she was getting better. Uh, we then sort of progressed. At that point, over the summer and into the fall, we were moving along. We weren't in the foot was not a player. We weren't doing anything to
Mhm.
challenge balance. Her knee pain was pretty good. Her arm pain had gotten better. I actually did at one point during that time, Susan, some cranial sacral work that I had learned from Doreen Killens up in Montreal. Just sort of calm the system down. We
Yeah.
did a lot of breath work and things like that, which really helped her. And she had a hard time sleeping, and sleeping was a big thing. So,
Mhm.
fast forward now, the she doing well, and then I would say maybe November, December, we started to really do some plyometrics, and that's when her system started to kick in again. Not her symptoms, but just that she felt every time she landed, she
Mhm.
felt off kilter. So I'm wondering, before I continue, what do you think is driving this in the postpartum woman? Is it
Nobody knows. We just know it's a thing, but nobody knows. So,
interesting?
I mean, we could come up with all kinds of theories and
Hmm.
assumptions, but it's something that I wasn't aware of until I met some PTs and we started talking about it, and I treated a few PTs with it,
Yep.
and started kind of like, I've just started over the last 6 years really asking this question, these questions about this, like, where do you sit in the car? When did you start? Oh, I haven't ridden a ride since my kids were born. Just little things like that, watching them, listening to them, watching their story, watching their gait. They don't walk. They're in a their gait has not like their stance and gait has not returned back to the way it was prior to pregnancy. So their feet are always a little bit apart, right? And that
Yep.
changes the whole thing, because we should be able to walk like almost across our feet. As humans, we have that rotation in there, and they've lost that rotation.
Yes.
That for me, it's like a loss of transverse plane motion all the way through the chain, from the feet all the way up, and then
Yep.
the up all the way down. I don't know what drives it. I
Yeah.
don't know if it comes from, being pregnant and doing that. I haven't looked at enough nulliparous women to say,
Mm.
is it maybe just a female thing, or is this but I hear this story a lot more in women who have had children.
Interesting. What would the riding in the car have to do with it?
Because when you have vestibular problems,
Mm-hmm.
most of them will tell you, I drive, because their hands are on the
Oh,
wheel and they have control. Or or I will sit in the front seat. I will not sit in the back seat.
oh,
I won't do
interesting.
it. I won't do it.
Okay.
So you can, and they'll tell you. I mean, it's not something that they'll be going, oh, I never thought about it. No, they will tell you, nope, I drive, or I sit in the front seat.
Okay.
If I get in the back seat, I get sick. I don't like being on airplanes. I don't, these kinds of things. I won't ride rides. And there are people who have ridden rides previously.
That's me. I won't
Yeah.
ride rides anymore. And I've never been pregnant. So,
Right, but see,
yeah,
at some
right,
point, like I said, I
right.
don't know if it's a hormonal change
Could be.
that's driving this or part of it, or if it's, like I haven't asked enough questions of other
Yeah.
populations as well. I just said,
Interesting.
know what I'm asking in this population. And when you see these kinds of things like this on somebody who's very, who's strong and fit
Yes.
and can't
Very.
land,
Yeah.
that's kind of weird. And it's kind of like, well, when did she stop doing those types of exercises?
Right.
Like,
Right.
what was the year? Was it after the first birth? Was it after the second birth? Was it, when did she make the decision to, like, I'm not doing that anymore? There
Yeah.
was something that happened, and they usually can remember, oh yeah, after my second child, I didn't do that anymore.
Yeah. I would say
Why? No, I
probably.
don't really remember why. And then sometimes they start thinking and they'll go, and you know what happened? Blah, 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 blah. Or,
Yeah.
and so it's very interesting. But what's cool about this is it's totally rehabable.
Yeah.
You just have to draw the balance system back in, and that's a lot of eye movements. And I love this because you said in the beginning, the head was the trigger. It's like,
True.
there
It
it
was.
is. There
It's
it
true.
is. And you can go back to that head thing
To
again.
this day, Susan, it's still her self-check.
Yes. And so that now you can kind of start going and stressing that system.
Right.
That
So,
system needs to be stressed. Eye movements, rapid eye movements, head movements, things like that, in space, standing still, then in movement, and, bringing it all along.
yes. Yes. So hold
Mhm.
that thought for a second. Yeah. So I would agree. What was I going to say? I was just looking at her Val. She may have stopped all of that before, maybe after her first child. I didn't
Mhm.
write it
Yeah.
down,
Yeah.
but she hasn't been doing it. But I will ask all those questions again because
Mhm.
she's made great progress,
Oh yeah.
and it's been for her and for me as well. She wants to get back. She wants to do a handstand. She wants to do cartwheels on the beach. Person
Mhm.
is like for all intents and purposes, a high level athlete as far as I'm concerned, right?
Mhm.
She wants to be able to do that. So no problems with basic, I mean, yes, issues with lifting her arms up of 8 pound overhead. Yeah, a little bit of upper trap recruitment, scalenes, things like that.
Mhm.
But I wanted to talk about the issue with her foot because I brought that in, and I'm going to say I brought those plyos in at an appropriate point in her
Mhm.
program.
Yeah.
Okay, and I don't normally, I can be aggressive or not aggressive depending on the patient, but I will tell you, given all of the stuff that happened to her in a short period of time, I said, I'm going to just really progress her by my quote unquote book. I'm going to literally do this, 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 and this. And so it wasn't that I added them too early.
No.
I
No.
did not.
Yeah. No.
And,
It just
and
didn't
I,
reveal itself until now.
exactly.
You
Exactly.
had to get through the sensitive nervous system and get that to change. And what I found interesting in your story is that when she got on hands and knees, even though she had been doing wall dogs and some of the other stuff, but when you got her partially inverted, then she
Mm-hmm.
started having trouble again,
Yep.
like on her hands and knees.
Yep.
So it'd be interesting to see if she can. Has she done downward dog on the ground?
Not yet. She's
Okay.
onto a table right now.
Okay, yeah. So, but see, that's the progression as you're bringing her down slowly,
Yeah.
so that her system has time to adapt to the new positions as she goes more and more towards inversion.
Yeah. Yeah.
Which is
Yep.
cool. But on hands and knees was maybe just a little bit more of a drop than she'd experienced before, because a
Totally.
lot of her system was offloaded onto her legs. So it could have been a bit of the sensitive nervous system, or it could have been just we're loading up in a weird position, and so the brain starts firing off that pain experience.
Right.
Who's to say? But no, I love the progression that you did, because every time you took her into new progressions, you saw new things,
Yes.
and were able to help her solve some new movement problems. And
Yeah.
now, as you kind of have she has the facility to start loading more and should load more. Now you're actually revealing some of the things that may have been really deep underneath there, but never were going to show because all this other stuff was so loud.
Exactly. Exactly. It's like peeling the layers of the onion off. You
Yeah,
peel
exactly.
one off at a time, right?
Totally.
Yeah.
But I just find it so interesting because when you said the head turn,
I know,
I
right?
mean, I wrote that down and circled it with big circles, because to me that was just like, there's something about this. I've got to figure.
And you know
She went through the story. It was great. Yeah.
And you know what's interesting? So we have we call these like reset exercises, right? So
Mm-hmm.
I progressed, excuse me, her reset. I mean, literally, it started out as like a wall land, and then it went into lunges, and then it went into lateral lunges with weights. And as I've loaded her system, I've had to progress that reset exercise. So interestingly, she's doing now a heel, like weights in her hand. Okay. Oh no, I'm sorry. A TheraBand, like holding a TheraBand, interlocking in one hand, so she's bringing it out in like an isometric. So she has the end of one TheraBand in her right, the end of the other TheraBand, the same TheraBand in her left. She's pulling it taut, and she's doing heel raises. So it's training the control in the thorax, and she's doing a heel raise. So when she does that, her self check, her cervical spine rotation is good every time she does that. She does any kind of movement, not any kind, but lower extremity movement, her neck rotation gets better.
Yeah.
Every
it's interesting,
time.
Right?
Yes, every single time. She can literally do a lunge. I had her doing walking lunges, forward lunges with weights in her hand. Her neck rotation got better. Amazing. And so that is why I continue to use it with her, because it is so sensitive to her issue.
Yeah. It'd be interesting
even with a foot issue now, right?
And since you know that, one of the things that would be very cool to do is to just do, eye movements and then recheck head rotation.
Fascinating.
And see if the eyes are away in.
Yep.
And then and if they are, then she can actually use that as a go-to thing if she's going into further inversion and doesn't feel good. She can pull eyes in, to kind of, now, how does that feel? Do the inversion again. Oh, better.
So what do you mean? So let's say she goes to table dog, and then what do I have her do? Just have her do in the middle of the movement?
Yeah. She can do left, right, up and down, diagonals, whatever. You need to call them out to her, though, so that she's reactive to it.
Yes.
So I think we've talked about this app before on the podcast, the Clock Yourself app.
Yes, that's right.
Yeah, and I have people just put the pretend clock on the wall and do the eye movements, just like they would if they were standing in the clock and doing the feet and the hopping movements. And that may be something for her down the road that she can progress to once her foot doesn't hurt and you have you see better foot control reaction out of it. Then she can pop up on that Clock Yourself app and do the hops and stuff and the jumps and the hand slaps and things like that.
Yep.
Because it's all reactive. So you can't anticipate.
Right.
Which is what you want in that world that I'm learning about so much every day, is that it's got to be reactive.
Yes.
So, so if you can call out the eye movements to her in the beginning when she's like in that position, that can be helpful.
Yeah.
Then she has to react to them and then see if it gets better. Or if she feels, if everything starts to flare off while she gets into downward dog, have her stand up, do the eye movements, then do it again. And see if it clears up. Kind of like you would do with the head turn. It's just another way in, just to kind of test and retest.
Exactly.
Yeah.
Exactly. So when I first found out that when we first sort of loaded the foot in dynamically, I went in, I just assessed her foot. I mean, I went in and I assessed her foot physically, manually. And I just did a little, soft tissue in her posterior medial subtalar joint, a little distraction, got her up, checked her head rotation, was much better.
Yeah.
I mean, right? So
that nervous system is just, the input to either end is like really important. The kind of doing some fun stuff with braided walking, forward, side to side, circles, step around backwards into walking in a circle backwards where they have to crisscross the backwards way, can also help recover that, that connection between the feet and the head all the way up, which I think would be cool. Is she having any pelvic health issues?
Possibly. She, in terms of no incontinence or leaking or anything like that, but she does have told me over, not in a big priority sort of way, but that she thinks that there's something going on, going on there.
Is she having pain with sex?
No.
What is she worried about with that?
No.
I'd like to know what she's worried about.
Yeah, I think it's probably more the not so much in the issue with her menstrual cycle and or possibly eliminating things like that have come up, may have some digestive issues, but
Okay.
she also feels that this is what she said, that when her foot is stable on the floor, this was a while ago, mind you,
Hmm.
her foot is stable on the floor, she feels that her pelvis is more supported.
Yeah, that makes sense. That totally does. She
So
may be over recruiting in her pelvic floor region because that's part of that whole threat thing. You
right,
know, that their system's been under threat. Her GI issues are probably because, well, she's not sleeping or she wasn't sleeping. You know,
right,
she, had all those other issues that you talked about. And when you have a system that's high ticking like that, the GI system is told not to work. And so you
right.
do end up with digestive issues because of that, because it's simply offline.
Yep, yep,
And so those pressures and things like that can drive that feeling through there too. So
yep.
that's kind of that's like the thorax being the outer piece, and that whole mechanism up into the upper ribs and the head
Mm-hmm.
is also connected internally through that whole esophagus from the mouth all the way down,
Yep,
through the GI system into the pelvic floor.
yep,
And so when that system is not, when it's being told to not work or it's aberrant, then that also drives that lack of rotation, because
yep,
your
yep,
your brain, why, of course it's going to protect it. It's like,
yep,
this has to be okay.
yep.
Nobody come near.
It's true because when I would, when she got more control in her thorax and her foot was, sort of better in terms of it was,
Hmm.
she felt it more on the floor. She felt that her abdominals would turn on, that she felt that
Hmm.
she had less of
Yeah.
a pressure belly type of thing,
Yeah. Yeah.
and
Hmm.
so yeah, so possibly yeah, it's interesting.
Hmm.
But I wanted to go back to the squat. She actually has a problem doing a very, very narrow based squat.
Hmm.
So she's always mentioned that. So when we did the wide-legged squat, she's like, I have no problem. When she literally had to narrow her base of support, which would challenge the balance system,
Hmm.
she has a problem with that. I mean, not mechanically in the sense that, oh, my calf is tight or, yeah, but
Right.
right, I have a problem, I can't do that for some time now. So that
That's
all feeds
interesting too.
back in.
Yeah, it feeds into the balance, plus it also feeds into that sensitive nervous system, because remember,
Mm,
as we come more together in the
yep.
middle, we have more tension.
Yes. Yes.
So you're getting
Yes.
neural tension hyped up again,
Yep.
and the balance system for sure, for
Yeah.
sure.
Yeah. It's interesting because um, I often check narrow and wide base on a lot of people now just to see what looks good, what doesn't, how do they look doing even just a narrow stance versus a wide stance. I often check that on people and I just note it down, and I do that if I'm looking at a squat, I'll do that as well. But she actually, when we were doing them, she actually mentioned that she's always had problems doing that. Like
Hmm.
she volunteered the information. So
That is
uh,
interesting.
it really is.
Hmm.
So moving forward, I mean, at this point now, I've not incorporated obviously the VOR, the reflexes, and things like that, but I certainly will. We've been doing basic foot progressions and things like that,
Hmm.
and we have not returned to the plyos yet at this point. Uh, but she's doing, basic foot progressions. I have her doing, we call it sling squats, heel raises, knees bent, knees straight, so you're basically knees bent, you lift your heels, straighten your knees, lower your heels, raise your heels, bend your knees at the top, lower your heels. So she's doing
Hmm.
that. She's doing lateral lunges, which is really hard to do for a foot. She's doing that. I had her doing lateral lunges on the Bosu ball.
Hmm.
I had her doing squats on the Bosu ball, flat side up, round side up. I had her
Hmm.
doing lunges, lateral step ups with weights in her hand. Anything lateral, because it will still challenge the thorax. It will challenge the foot. The Bosu obviously will challenge the balance. So she's really good with all of that now. So the only thing at this point left is to incorporate more of the higher impact, more weight bearing through the arms, more inversion postures, and perhaps, I mean, I've done rotation with her. She doesn't seem to have much of a problem with that, to be honest. I think it's really more the weight bearing on the arms, getting into that inversion, and also doing the plyometrics.
Mm-hmm.
So I'll definitely do the clock me and the eye control. Any other
Yeah, she
suggestions?
can do the clock yourself in the legs too.
Right.
Just that whole, because that thing progresses up really high.
Yeah. Yeah.
Which could be good. That's just I'm just thinking about her being home.
Right.
With all of
Right.
us, kind of
Yeah. We're home.
homeschooling and home quarantining these days.
Yep.
Having apps and things that really work that can really help our systems change and develop differently can be quite helpful.
Yeah, she's got
Um,
Bosu ball at home. She
mhm.
said she's got
Yeah,
the
and if she
therapy.
doesn't, for those of you who don't, I mean, I get people to take a couple of towels, that
Yeah.
are folded and throw them on the floor, because when you go to step on them, they squish and move all over the place. So,
Yeah.
anything that you can do unpredictable, that like a Bosu
Mhm.
ball can be helpful. Most
Mhm.
people don't have foam maps and Bosu balls at home,
Yep.
but our clients all have towels and sheets
Yes.
and,
Yes.
slippery clothes and things like that. You want to be safe, of course, but,
Yes.
there's ways
Yeah.
to mimic some of this stuff,
Yep.
for them at home. Step ups, most everybody has a stair or a curb somewhere.
Yep.
There's all kinds of ways to get creative.
Mhm.
Working with folks in their home environments,
Yeah.
while they're like I say, while we're all kind of social distancing and all these new words that I'm learning,
Yeah.
sheltering in place, and
Yes, I know. There'll be the word of the year,
oh my gosh,
social distancing to the
yeah.
words of the year.
Mhm.
Yeah, so I will do, I mean, I gave her backwards walking and things like that. That's easy for her, but I like the backwards with the turning and
Mhm.
of the head. It's really interesting because I'm going to have her focus more on that now that she can, is more home at this point, and she
Mhm.
can do that. Because at this point, her thoracic control is actually okay. And the reason why I brought her up is because uh, we always have, because people have had persistent issues for so long, generally have more than one driver or one cause. But when you
Mhm.
start to progress your patient into more heavy load, if she didn't do jump squats or anything, it may not have even come up. It may
Right.
have, but the more you start to progress your patient to higher levels, it's not like the rehab was wrong. It's just that something else is coming up
Yeah.
that
It's just
wasn't.
like, yeah.
It's
What is
another.
their system unable to cope
Exactly.
with? Mhm.
Exactly. And that's a good thing because that's how you get the person back to quote unquote full function. I mean, especially when you have kids. I mean, you're going to be playing with them, you're going to be doing cartwheels on the beach. That's inversion. That's a lot. Doing a cartwheel on the beach just has me dizzy thinking about it. To be honest, that's my system, right? But I think that it's important to note that, be open to other sources of the problem,
Mhm.
when you know that you've rehabbed your patient appropriately.
Right.
It's
But
not
that
like,
and yeah, and I think that we all discharge our patients way too soon.
yes, I agree.
And I'm going to throw this out there. I think pelvic health therapists discharge their patients way too soon.
Yeah.
They don't take the time to take them into these higher level activities and see what is happening, because there's more than just the pelvic floor involved. It's this entire system that's involved, and
Yeah.
rehabbing that entire system and getting them much more, active with that whole system, not just jumping up and down or doing jumping jacks, but I'm talking about, all of these things like you're talking about. They should be challenged into that, because you're never going to know what's going to show up and where the other pieces are
Yeah.
that could have led to, whatever issues that they're having.
Yeah, no, I agree 100%. And I've been treating her for a bit now, but I actually may write her case study up is for published because it was so interesting. And
Hmm.
I do agree with you. I think we do discharge way too early. And I mean, I think at the end of the day, if people are like, I don't need to do this, I don't need to do a handstand. Okay, fine, but you live your life.
But do you pick clothes up off the floor?
Exactly, exactly.
Or did you quit crawling under your bed to get things out?
I know. Exactly. Do you look up with your head to the left while you're,
Hmm.
like, are you vacuuming? Or are you, picking?
Right.
Are you going in and reaching up and things out of your cupboard? Many
Hmm.
things,
Are you
and
gardening? Yeah, there's so many things in life where we're in inverted postures and positions that we need to be looking at that a lot more. Yep.
yeah, and I agree. So I'll progress her to all her table dog or down dog, and I'll add those, and I'll have her do some of those circles, backward circles, and that's amazing. So this is great. This wasn't honestly, Susan, and we just sort of went with this patient, and I wanted to bring her up because, as I said, she was very much of a secondary issue came up. But I think this was great discussion, and I hope everybody enjoyed it because I certainly did. Thank you, Susan.
Yep.
All righty. Bye, everybody.
Bye.
Enjoy. See you in a couple weeks.